The number of calls to air ambulances is taking off. One team we spoke to said in the last 4 weeks, it's doubled. Rural communities are struggling now more than ever, according to North Central Region's Air Methods account executive Kevin Hallam.
It's usually 5 to 6 flights a week. We're averaging sometimes 10 to 12 now a week.
He says the Thanksgiving holiday contributed. Hallam believes social gatherings are increasing the spread of the virus.
The volume's picked up for other things as well, too. So it's not necessarily just strictly COVID, but COVID does play a good part into it.
Flight nurse Lona Smith says it's not just an uptick in calls. COVID-19 is keeping the air ambulance team busy in other ways.
We have to do a lot more cleaning, and we wear more PPE. We are making sure that all of our equipment inside the aircraft has been either covered or is covered if we're carrying a COVID patient. And then once we've carried a COVID patient, then we have to decontam ourselves. We have to decontam the aircraft.
Rather than being able to quickly turn around between calls, it now takes an average of 2 hours to decontaminate the aircraft.
That's probably the biggest stressor right there, is that we can't get there when we need to be getting there.
The ambulance has also added more equipment to help. The team says they could also use an extra hand.
Staffing has been a challenge at times in some bases. We've been pretty safe here in Nebraska. We occasionally have had some of our clinicians and pilots, catch COVID, where they've gotten into isolation for quite a while. But having so many bases throughout the state of Nebraska and throughout the country, we can pull staff from other places to fill in, and that's been huge to keep our bases up and running.
He says what also has helped greatly is hospitals chiming in with assistance, especially for the rural communities of Nebraska.
So our rural communities and some of these healthcare systems just don't have the level of critical care that's needed. They don't have ventilators. They don't have a lot of the staff that is needed at times. So getting those patients out is pretty critical.
He hopes it's not just hospital workers, but everyday Nebraskans who will step up to prevent another surge.
I'm very proud to be a part of this. It's really a big team effort.
In Norfolk, Carolyn, Conte, News Channel, Nebraska.